Welcome back to CHN Now. In tonight's Upside Report, field reporter Carly Mullane talks with Dr. Mike Weiner of the Brain Health Registry. He'll tell us about the importance of people participating in the registry in order to help discover treatments and cures to brain disorders such as Alzheimer's.
We're on campus at the UCSF Veterans Administration to talk to Dr. Mike Weiner about the Brain Health Registry. Thank you so much for joining us.
Happy to be here.
So let's just start off with, what is the Brain Health Registry?
The Brain Health Registry is a website for recruitment, assessment, and longitudinal monitoring of subjects for neuroscience research.
You're clearly passionate about this project and this cause. What drove you to this line of work?
Many of us are going to be living to over age 85.
Right.
So how are we going to get effective treatments? We do research. We do what we call clinical trials, and we need to get more people involved in clinical trials.
Well, the Brain Health Registry really does attempt to make the process easy to attract everybody, right?
Right. You go to the website, you give your name and your email address, and you sign what's a very simple informed consent. Mm-hmm. And then we ask questions about your memory and about your health and what medications you take and whether you have a family history of any brain problems. And then there are some tests or games which kind of test your mental function, which you play. They're a little tricky sometimes. And then we ask people to come back regularly to get longitudinal data.
The success of the Brain Health Registry depends largely on its pool of participants, and joining us now is Karen Kiefer, one of those participants. Hi, Karen.
Hi, Carly.
I understand you do have a personal connection to Alzheimer's.
I do. My Aunt Ruth, I brought a picture, had Alzheimer's. I don't know whether I'm someone with a gene, because my parents were both pretty healthy mentally, but what triggers Alzheimer's? Why does Aunt Ruth have Alzheimer's and no one else does?
What would you say to folks who you encounter who don't know what this is and maybe a little hesitant to sign up? What advice would you have for them?
I think we all need to be part of the solution. We don't know whether we'll have Alzheimer's or someone we love will have Alzheimer's, whether we'll have to take care of someone, like a parent that has Alzheimer's. So the more people who participate, the more readily, hopefully, that psychologists, psychiatrists can find a solution.
In addition to having a large pool of participants, it's also important to have a diverse group of folks, and we are now going to speak with someone in a younger demographic. Ashley Borman, thank you for joining us.
Thank you.
So tell us your personal connection to this project.
My dad, both of his parents, my grandparents, actually both suffered from Alzheimer's and passed away from the disease. It's something, as a younger person, I feel like sometimes you're not sure if you can really help out. People that typically get Alzheimer's are older in age, so here am I, like in my late 20s, what am I going to do? Well, I can do something now by joining the Brain Health Registry and giving them my data and my experience.
And brain health is something that we really all should be thinking about, not just when we possibly might have some symptoms, right?
Absolutely. I think as people age, they think a lot about their physical health. What if somebody falls or, but mental health, gosh, people really don't think about that sometimes, and it's so important, which is why, places and sites like the Brain Health Registry are really vital, and anybody can do it. Absolutely anybody can do it.
I think that ultimately questions about brain health and maybe even these online neuropsychological tests will be part of something that we're doing when we interact with our medical provider.
It's really interesting that technology is opening up access, which will have a greater group of participants, which may speed up innovation to find a cure.
They used to say that older people don't use the internet, but that's not true. More and more people in their 70s and 80s are regularly using the internet and are joining the Brain Health Registry.
Well, we look forward to the progress that this project might push forward sooner rather than later. Thank you so much.
Thanks, my pleasure.
Joining us now in the studio for an up-close interview is Dr. Mike Weiner. Hello, Dr. Weiner. Thanks for joining us.
Nice to be here.
So first off, talk about Alzheimer's and what people need to understand about it.
Alzheimer's is a disease that produces cognitive decline. It produces memory problems, changes in thinking, and leads to dementia. It occurs in older people, people usually over the age of 65. And right now, millions of Americans have Alzheimer's disease, and there's no effective treatment, no effective prevention.
And as we just saw in the story about the online registry, where did you get the idea to create an online registry?
Well, I've been doing research on Alzheimer's disease for more than 25 years, and the biggest problem is just getting people into our studies. Our clinic and other centers around the country are doing research on Alzheimer's disease, trying to find out the cause, trying to find effective treatments. And one big problem is just how do we get people to come into our research? So it occurred to me, well, why not use the internet, since the internet's being used for just about everything else, and try to get people involved in a research project, and then they can be directed to various clinics if they want to be involved.
And you also want to reach out to different segments of the population?
Yes, I mean, the beauty of the internet is almost everybody has a mobile device or access to the internet in some way. It's very commonly used, as we all know, and this is a way to get people connected, give people a chance to participate in research. Even if they don't even ever go to a clinic, they can participate in research by joining the Brain Health Registry.
So the Brain Health Registry, what other things are you hoping to uncover using that registry and being able to reach other people that might not normally be involved?
The Brain Health Registry is for recruitment, assessment, and longitudinal monitoring. We believe that in the long run, the scientists and doctors will use the internet to monitor people's brain health over time and identify people who are at risk, people who might just beginning to show the very earliest signs of Alzheimer's disease, maybe even before the person even realizes it. And that way we can target people and get them the effective treatment to prevent the development of Alzheimer's disease. Of course, we need to have treatments that really work, but in anticipation of that, we think the internet would be a way to diagnose people or at least identify people for workup in clinics.
And when it comes to the trials, you're doing more research through clinical trials. Now, if someone was to participate in a clinical trial, what could they expect?
Well, a typical clinical trial for Alzheimer's disease means that you go to a clinic, you asked about a lot of questions about your health, you take some tests to test your memory function and how well you think. You may have an MRI scan or a PET scan to look at your brain, see how your brain is functioning and whether you have early signs of Alzheimer's disease. Then typically people are randomized. They're either given a sugar pill or an active treatment, and then they're followed usually for 2 to 3 years to see whether the treatment works.
And so as you do this research, as you do these clinical trials, what are you hoping to accomplish in the next 5 years, 10 years, looking down the road 15 years?
Well, what everybody wants is a treatment that prevents Alzheimer's disease. After all, many of us have seen our families or our friends affected by this horrible disease that leads to dementia. And as everybody gets older, it's going to become more and more common. So we need effective treatments that work. And there's a number of clinical trials going on right now. We're very hopeful that one of these is really going to work. So I think in the long run, we'll have treatments that will treat Alzheimer's, prevent Alzheimer's, and we'll be able to use online tools like the Brain Health Registry to identify people who need the treatments.
And if someone's watching right now and they never really thought about becoming part of a study or participating, what would be your pitch to them to sign up for the Brain Health Registry?
Well, they should go to the Brain Health Registry, take a look at it, just spend a few minutes to see if they enjoy the experience, if they get something out of it, if they feel that they're contributing. This is a simple way, sitting in your home, that you can kind of give something back, help the community, get involved, and maybe in the end you'll be contacted. You might be interested in going to a trial. If not, just keep coming back to the Brain Health Registry. We can learn something and you can help cure Alzheimer's.
And when it comes to Alzheimer's, what's one thing that people really need to understand about the disease?
There's hope. There's active treatments. We know that Alzheimer's is caused by 2 proteins, amyloid and tau, and there are treatments going on right now in research that remove amyloid and tau from the brain. So we think that one of these treatments is going to be effective.
All right, Dr. Weiner, thank you so much for coming in. It was great to learn about the Brain Health Registry and the work you're doing with Alzheimer's.
My pleasure. Thanks very much for having me.
We'll be back with more after this.